Harmony is based on the patients. It's based on the patients with leukemia, with lymphoma, with myeloma, with myelodysplastic syndromes, also in childhood patients with hematological malignancies. We want to generate, we want to build up a large database of patients, but not a database in which we will include any kind of data. We want to work from projects, from specific projects, asking or trying to reply specific questions. The hot questions, important questions from the patients, from the different patients that we have defined in the last 10 years. In hematology, there are a lot of things that there has been more or less resolved, but there are still unmet questions and unmet problems that we have to resolve. And one way to resolve this question is to build up, to share, to have a quite large, a quite huge database in which we will be able to collect thousands and thousands of patients to provide the best approach and the best kind for the analytics of this data. And this is the reason why Harmony is integrated in the big data for better outcomes. This is a program led by the IMI office and led by the European Commission, in which we will be one of the first projects in health that will use the big data to resolve the questions that we have to resolve. Which therapy is better? Which is the quality of life of the patients with this kind of therapy or this other? We are not talking about hundreds of patients, we are talking about thousands of patients. As hematological malignancies are not really frequent, they are really not prevalent diseases, so we have to share the data. The data are there, the data are in the different working cooperative groups in the different countries in Europe, but usually they are a little bit close to these countries. We have to try, we are now trying to open this database to share the data in order to provide the answer to the hot question. This question will be different from the acute myeloblastic leukemia than for the acute lymphoblastic or chronic lymphocytic leukemia. And this is the reason why we are planning to work by projects. Yeah, this is a recurrent question. First of all, I have to tell you that this is a scientific project, but also we have to include patients, we have to include regulatory agencies, so it's really a social project. It is not only a scientific project, because of the involvement of the several stakeholders, mainly patient advocacies, HTAs and other institutions. So it is something that is let's say, is much more a comprehensive project, let's say a social project. The project is scheduled for 5 years, and usually the impact on the patients, it is quite difficult to be established or to be pre-established. So for the different projects, it is quite difficult to, let's say, to focus in, this is in 1 year, we will see, when in a couple of years. Our aim is also to provide or trying to short the period of time of a drug. At the time that the drug is provided or is checked for the first time, and the time that the drug is coming to the bedside. So it is now, it is about 10 years. So we are fighting, we are expecting to reduce this time, even because we have to be able to sit at the same table all the stakeholders involved in the field. And in that way, we should be able to, let's say, to shorten this period. But I don't know if this will achieve in 3 or 4 years. But what I keep in mind that this is important to reduce and to consider the therapy of a hematological patient in a different way, like we are considering the therapy of, let's say, hypertension or diabetes, because diabetes is so frequent that you can engage, you can recruit, let's say, 10,000 patients without any kind of problem. Here now we are working more and more for a personalized therapy in which we detect a mutation And for this mutation, we will have a specific therapy, but this mutation is so rare that maybe you detect this mutation, let's say, in 3 cases in 1 country, 1 year. So it is not possible to do a clinical trial in that way. Well, we try to involve everything who was really in charge or related to the hematological malignancies. It is an open project. In fact, we are involving several partners as a full members, but we are also involving associated members. The associated members are mainly the working cooperative groups, some patient associations, because according to the IMI rules, we cannot do a consortium of 100 or 150 partners. So it is something that is clear. And I think everybody accepted this kind of role. So we are about more than 100 people here in this meeting. It is 130 people attending, working with also the pharmaceutical companies. So at the same time, in the same page. So it is, it is an open project. So are still receiving proposal from the associated member to become a member. And we are really open to all of these people who we are able to come and to join us and to produce data in a very positive way, so this is important. And also it's important to have this meeting like we have this kickoff meeting here in Salamanca, because we feel that we have to do a lot of interaction between us. So because sometimes we don't understand each other, we are talking in a different language. And sometimes it takes time to sit in the same room and to start to talk, okay, which are our goals? Our goals is to improve the quality of life, to improve the survival of the patients. So let's go to do and to work in the same way. Sometimes it's not easy to do that, but it is the way to start to work. And I'm quite sure that future projects will do it in the same way, in the same page.